asebedo gi sida mar wang' mara ni kuom dweche koro dhi 8. Wang'a konchiel otimo mbui. Koro gik moko duto te kaneno to riwore gi bedo mana ma rachar. Koro kanyal neno maler. Mana ka ng'ato biro buta machiegni kabisa ka ng'eni mang'a makama. To ka en mabor matin to kanyal ng'eyo.
Abinda asebedo gi chandruok mar wang'no madhi higa. Wenge na chanda kanindo gotieno to kachung' kar saa 7-8 kanyo kata kadwa dhi e short call to gimoko ti to katemo ni mondo ahenygi to gichwero mana pi.
These and many of such heartbreaking testimonials, sad tales told by a majority of the old, both men and women, the young, not an exception, prompted the county government of Kisumu through the Department of Health with the strategic partnership model that targeted like-minded organizations, this time the Pankaj Foundation, to roll out an ambitious eye medical camp stationed at 2 medical facilities in each of the 8 sub-counties. Jaramogi Oginga Odinga Teaching and Referral Hospital playing a key role in the successful implementation.
We started with Kombewa and Manywanda. We visited Chiga, we visited Moroni, Gita, Nyang'ande.
During the eye medical camp that included but not limited to eye screening and general diagnosis, patients were also offered, free of charge, specialized treatment. Majority of them, approximately 90%, being the old and vulnerable and drawn from rural settings across the county. Those who were screened and found to have had a cataract, a clouding of the lens in the eye, a condition that develops with aging, or if an injury changes the tissue that makes up the eye lens, were not only referred to Jaramogi Oginga Odinga Teaching and Referral Hospital, but were also transported to and from their respective homes after successful surgery.
We've been screening eye patients who have various conditions, not just limited to cataract. Even those who have infections, we've been providing medications, we've been giving eye drops. And for those who have cataracts, we've been doing referrals to Jaramogi Oginga Odinga Hospital for cataract surgery, and transport has been provided for these patients. So when we identify a patient who has a cataract, we do a booking on a certain specific date. We give them the date and they are picked by a bus and ferried to Jaramogi for the cataract surgery.
So far, we have seen 1,046 patients, of which we have 174 cataracts. Yeah, the highest percentage are the old. I can say 90% of the patients are the old.
So the clinical team of Jaramogi Oginga Odinga Hospital, especially the eye department, they have been key in this whole exercise because they are the ones who've been at the forefront of this screening activity.
A day after successful surgery, we find and interact with a few patients out of the 600 successfully operated on before they are transported back home. The result, absolutely different testimonials with happy endings.
Chieng manange no angane rach ne en higa mokalo. En higa mokalo. Koro kana bet piny to awinjo ka wanga koni bet rama. Koro kaningo koni taneno ka tipo moro wuok. Ng'ama ni mabor ok ane. Kata ng'ama ni machiegni ok ane maber. Koro kanye kama nang'ego ni wang'a koni rach.
Wach mar thieth ni nang'eyo kane jogi obiro papo nditi. Ne githiedho tuo moro amora. Koro ambe nadhi nikech wang'a osebedo ka chanda. Kanadhi to ne girwaka maber, ne ging'iyo wang'a, ne giyudo ni an gi chiero e wang'a. Koro ne gikona ni gibiro loso thieth, gibiro kawowa to gikelowa gilosonwa wang'wa.
Wachopo Kanyoro. Koro kelwa gi bus ma free, ok wachulo. Wachiemo maber nyaka ne wabi. Kato koro sani oseterwa e theatre. Koro ok wawinj marach, wawinjo maber. Koro wagone Nyasaye erokamano kuom chiwruok ma jo osiptal ochiworego mondo thiedhwa. Wagone Nyasaye erokamano.
According to Jacqueline Sagina, a staff at the eye department at the Jaramogi Oginga Odinga Teaching and Referral Hospital, such initiatives help a great deal to not only bridge the gap in healthcare, but also serves to bring services closer to the people, and shares her insight from the experience attributed to the free medical camp, while the Deputy Governor, Dr. Matthew Zowili, and the Chief Executive Officer, Dr. Richard Lesiampe, both took the moment to not only emphasize but also encourage more strategic partnerships even in the future.
We've traversed Kisumu County, all the way from Manywanda, even up to Kandege in Muhoroni Sub-County, looking for cataract patients. And we were able to screen over 1,000 cases, and we were able to get over 150 patients who require cataract surgery. Patients are appreciating our services. Those who are not able to see are able to see, and they are having their quality of life restored. So we are grateful for this gesture and venture because it has brought services much closer to our people, and we are grateful to the planners and the organizers, the county government of Kisumu, specifically the Department of Health, under the leadership of Waziri Dr. Ganda and Dr. Lucy, the Chief Officer of Health, and also our CEO, Dr. Lesiampe.
Financing budgets is not a very easy thing, you know, not just for the county government, but national governments as well. There's always that budget deficit. There's the shareable revenue, and then there is the, you know, own source revenue. But even then, you still get a deficit. And so if you get a partner with a big heart, you know, like the Pankaj Foundation, you know, stepping in to bridge that gap, I mean, what can we say? We can only say we thank them.
We have a strategy on community engagement and also on partnership. We want to call upon other partners to come on board to support us in other disease burdens and disease conditions.
When asked to give a message to those who missed the once-in-a-lifetime opportunity, Jacqueline Sagina had this to say.
They might have missed that opportunity, but our department is running the eye clinic, or rather just the whole of the eye department, plus the inpatient section, plus the eye theater. We are on every day in this hospital from Monday to Friday. That is at the outpatient section. All emergencies are seen at any given time. Be it at night, be it over the weekends and the public holidays, we are on. Cases that require surgeries, emergency, we do them every other day.
These and many more are just but a few services aligned for the general population of Kisumu County and by extension the entire Western region in its pursuit to becoming a center of excellence in health outcomes as spelled in its vision statement as it strives to achieve its mission in the provision of accessible, responsive, quality, specialized medical services, training and research. Would you like to become part of the successful stories? Join us as a partner at Jaramogi Oginga Odinga Teaching and Referral Hospital and help us give hope to the hopeless.